Lip tie services.
Joining us now with more on oral health and wellness trends is owner Dr. Justin Wilkie. Thank you for coming in. I first remember hearing about tongue tie, obviously, when my children were born, because it was a condition that could affect breastfeeding. But there are other issues that come along with tongue tie. But the one question I always had, shouldn't that be easy to detect?
You'd think so. And that's what we do at the Chicago Tongue Tie Center is we help to unravel the complexity of figuring out, does your child, do you have a tongue tie, a lip tie, or restricted oral tissue? Because some are clear as day. You open up, for instance, your baby's mouth and you can see it right there. And others are kind of hidden, they call it a posterior tongue tie, where you have to look under the tissues to see where there's actually a restriction. And so that's the specialty service that we are about, so that we can truly identify, is it there, is it not there?
Okay. Interesting. Okay, we were talking in the break about all the TikTok trends out there. We always try to dispel the myths. And one that's been circulating a lot recently are people are taping their mouth closed when they sleep at night. It's supposed to prevent snoring or something?
Yes, so it's, the latest trend on TikTok. This mouth taping, and number one, it's dangerous.
Okay.
Mouth taping should really only be happening in adults, and it should be done only under the advice of a professional.
Okay.
When done right, it can be helpful. It can help with snoring.
Okay.
And in terms of a restricted oral tissue, a tongue tie, and how this might play in, yes, if you have a tongue tie, your child has a tongue tie, you have a tongue tie, that could cause mouth breathing, because when a tongue tie happens, you can't quite move your tongue as much as you normally should. Therefore, your palate and your airway don't fully develop, thus causing you to have difficulties breathing through your nose.
Okay.
So you start to breathe through your mouth. But mouth taping, again, dangerous. Stay away from it unless it's from a professional telling you how to do it, which is just a little piece of tape over the front of your mouth, not the hole like you see in the movie.
Tape all the way across
the duct tape all the way across.
Duct tape. And you can't, so when you are having an issue with a tongue tie or a lip tie, how does it present itself? Are you stuttering? Are you not able to eat? What are some of the issues that you're dealing with that?
Yeah, great question. That's the first thing that people ask me when they come in and they say, I'm having this, and this going on, and I think it might be related to a tongue tie, in my baby or with me. Can we talk more about this? And most frequently in a newborn, it's like you said, they're not able to feed as well as what seems like they should be able to feed, or mother's having a lot of pain while breastfeeding.
Oh, okay.
Baby's not gaining weight. Then as the child gets older, if there's still a restriction present, it becomes prevalent in speech.
Got it.
As you can imagine, if you can't move your tongue, that you're in the business of that. If you can't move your tongue, you can't speak. So as adults get older, they might say, I really have trouble with these sounds. Or children, as they get older, their parents are saying, our oldest child didn't have this, now our current child can't say this word. And that's where we start to look at the anatomy of the mouth to see, is the tongue able to move how it should to be able to make these sounds. And as you get older, there could be other issues just in the way the jaws form. If you can't move your tongue, you start to compromise how you swallow foods. And you start to compromise how you chew and eat and swallow, which can cause TMJ disorder. So there's a lot of things that if you don't catch this early, can cause problems, not just then, but as you go on in life.
We're almost out of time, but do you see a lot of adults? Because I feel like the tongue tie thing wasn't something that we all knew about until much later.
Yeah, so it's becoming more and more talked about, and that's why we started the Chicago Tongue Tie Center, the first center of its kind in the Midwest that is dedicated to just the assessment and treatment of mouths and taking care of families and taking care of kids safely. And so, now that it's become more popular, we're seeing more and more adults who are coming in.
That's what I have.
Yes. So we always say, come on in, let's talk about it comprehensively, let's see what's going on, because just maybe that's what's been causing this your whole life, and certainly we can treat that. It's never too late, like many things, to treat it, and it can be life-changing. We see it certainly in babies. It changes parents and families and babies' lives. I mean, we see it right away, and so that's why we built the center, and that's why we're doing it, because it really changes lives and makes the quality of life so much better for families.
I can imagine.
Yeah.
All right.
Thank you.
Yeah.
Thank you so much for coming in and sharing.
Thank
Good
you
luck
for
to
having
you.
me. Honored to be here. Grew up watching WGN in
great.
Chicago.
Good to
so
hear.
Thank you so much.
Thank you,
Really
Doctor.